that compensation will always be opposite. So now let's do some examples. See that if you people have. So we have an example. Number one is pH is 7.1. Partial pressure of carbon dioxide is 2.5 and Bx excess is -14. So what's the first step? The first step is to determine the pH, and the pH is
acidic.
Acidic. So it's acidosis. So write acidosis, write down acidosis. Now we are going to determine the respiratory component and then metabolic component. So PCO2 is 2.5. Partial pressure of 2.5, that is decreased.
Alkalosis.
So we can say that this acidic pH is not due to a respiratory problem, because in acidosis, CO2 should increase, but in this case, there's a decrease in the partial pressure of carbon dioxide. It is you can say it is a respiratory compensation for this acidosis. Now, the third step was to determine the metabolic component, and base excess is.
Sir, please explain this step. That if PCO2 is decreased, then please explain it again.
So pH is acidic. So now we are going to determine the cause of this acidic pH. So acidic pH will either be due to respiratory component or due to metabolic component. Is that right?
Yes, sir.
So in the second step, let's look at the respiratory component. The partial pressure of carbon dioxide is decreased. So we can say that this acidic pH is not due to this respiratory problem or carbon dioxide problem. Can we say that?
Yes, sir. If PCO2 is increased, then we can say it is acidosis, like it is respiratory.
Yes.
Right?
Now, yes, that's right. Now, the third step or the third component is to determine the metabolic component. So the metabolic component is base excess is in the minus. So there is the base is in the -14, or base is -14 less in the body. So less base means the acidosis is due to this metabolic component. So it is metabolic acidosis. And what will be the compensation in metabolic acidosis? Respiratory alkalosis. That is a decrease in the partial pressure of carbon dioxide. So you can see that the partial pressure of carbon dioxide is decreased. So this is the compensation. This is the basic acid-base subnormality, which has led to this decrease in pH. So it is metabolic acidosis with partial respiratory compensation.
If it's only metabolic acidosis or alkalosis, whatever is this, so partial pressure of carbon
Dr.
dioxide.
Mlia, I cannot hear you. Dr. Mlia, what were you asking?
Sir,
can you hear me now?
Yes, yes, I can hear you.
Okay, I was asking, like, if it's like metabolic acidosis without respiratory compensation, so pH would be low, bicarbonate would be low, and partial pressure of carbon dioxide would be normal if no respiratory compensation.
No, as a compensation in metabolic acidosis, what is the compensation for metabolic acidosis? Respiratory alkalosis. And respiratory alkalosis means a low partial pressure of carbon dioxide. So in metabolic acidosis, partial pressure of carbon dioxide should be decreased.
Yeah, I understand. But if like respiratory compensation has not yet been started, so PCO2 would be normal in metabolic
Yes,
acidosis?
if the respiratory, remember that respiratory compensation is immediate. So it will be
Okay.
started immediately.
Okay.
Metabolic compensation takes usually some time. So what you are asking is that if respiratory compensation is not started, then partial pressure of carbon dioxide should be normal between the 4.7 to 6.
Okay, doctor. I understand. Thank you.
Dr. Shaw, can you explain about this base excess minus 14? I'm unable to understand that.
Yes, that's what I want to ask. Yes.
Base excess minus 14. Can you please explain that?
Dr. Shah, can you hear us?
Dr. Musharat, you want to ask question about base excess?
Yeah, so this minus 14, I could not understand how this is compensatory acidosis.